Good morning, everyone. A late start, thanks to Bill Nixon, who's Director of our Technology and Innovation Department, to cure most of the glitches that we were facing. Again, as was stated earlier, we are unable to be seen on Facebook this morning, but instructions have gone out on that social media outlet as to how folks can listen to and access the Zoom for their observation of discussions and activities. The first thing we want to do is call the roll this morning so we know for sure how many members, and assuming all members of the task force are present. Mr. Connor will call the names.
Sure. Thank you, Chairman. Chairman Eilert?
Here.
Commissioner Brown?
Brown, here.
Commissioner Hanslick?
Commissioner Hanslick, here.
Penny Postoke Ferguson?
Here.
Dr. Sami Ariola?
Here.
Dan Robeson?
Here.
Scott Anderson?
Here.
Tracy Osborne Olchin?
Here.
Frank Link? Saw Frank on there. Frank, are you?
Here. Sorry,
Thank you.
on mute.
All right, thank you. Mayor Eric Michelson?
Here.
Becky Yoakum?
Here.
Julie Brewer?
Here.
Stan Holm?
Oh, he just sent a message saying his microphone went out when he came back, but he's on. Bill, can you verify that? Stan just sent me a message. And he's working on getting his microphone fixed.
Okay.
Okay. Thank you, Stan. And then Chief Troy Reddick.
I'm here.
Thank you, Chief. That's
All right,
everybody.
thank you all very much. This is Ed Eilert. Why don't we begin, Commissioner Brown, you said you had an update from the governor's office on these items? Go ahead.
I do. Thank you. So is the link to this meeting now on the Johnson County website front page? Because I'm looking and I don't see it. And I've got people asking now. They can't find it either. Can someone?
Yeah, Justin's attending to that.
Yeah, Justin just said he just saw it. He's going to double check that it's still there.
Okay. All right. So I was just on a call, Kansas Chamber of Commerce call with the governor, and it was her statement was that she believed that we were going to let her order. She believed her order was going to sunset per order 20-16, and then the subsequent extension of that at May 3rd, and that counties would then be responsible and take over the responsibility for how to open up, how best to open up, best practices for opening up, and or to decide if their county, as we have seen in some other counties in Kansas, with some explosion of this COVID-19, perhaps they need to extend their order longer. I just wanted to share that with the group because it is, the rumor mill has been that she was going to extend it. She said quite clearly today that it is not her intention, short of some new information that she does not have right now. It is not her intention to extend past May 3rd. Thank you.
Okay. All right. Thank you very much. Well, again, in our particular situation for the task force, we're looking at developing the process for reopening, undetermined at this time when that date would be. And again, as a reminder, the recommendation of the task force will go to the Board of County Commissioners for their final determination on the phasing process. I have a couple of ideas of objectives that we want to accomplish today. The principles that are going to be presented by Joe Connor as a draft. Also, in those principles, a timeline, a period of time for the phasing, and then the ranking of companies or businesses and where they will be placed in the phase process. There may be others, and would be glad to receive those comments or ideas. I remind, we do have a meeting.
Sound check. Is Brown off?
I just lost the sound as well.
I did too.
Me
Yeah.
too.
Yeah.
Chairman, we can't hear you.
Try that.
Oh, yeah,
Sorry.
you muted it.
That was my fault, sorry.
The county manager closed me out.
I
don't
thought it
know
was-
why.
I thought I was muting myself. Sorry about that.
All right, I'll go back and repeat. I don't know how much you did not hear, but thinking about today's objectives, the staff has presented a broad outline of some principles, some time reference for the phase down, and then some broad categories for ranking companies as to what position in the phase that they would occupy. We do have another meeting scheduled Monday, and as if needed, one Tuesday. But I think the objective would be that at the conclusion of Tuesday's meeting, we would have details and be prepared then to make a recommendation to the Board of County Commissioners. If necessary, we can defer that until Tuesday. The Board of County Commissioners has a special session scheduled for Tuesday at 3 p.m. So with that background, I thought maybe it might be a good idea to start the presentation this morning with a rundown of the governor's order and what has been considered essential businesses during that order. It seems to me going forward, whether the stay-at-home is extended or not, it would be a good idea for all of us to have a summary of what those essential businesses are, and going forward, adopt that process also. So, Joe?
Sure, thank you. This is a summary of what the governor has considered an essential business. I'm not going to read through all those, but you can clearly see what the intention was. Some of the additional essential businesses.
I think there's about 4 or 5 slides
5.
altogether.
I think this is the last slide. So there's quite a list of essential businesses that are, we're making the assumption that they're still up and running and with modifications. And this is part of the executive order for the whole state of Kansas at this point.
Right. But again, I think we need to keep those in mind as we move forward in the phasing process, or whatever other determination is made by the public health officials. So, Joe, well, let me ask you this. There were 2 or 3 emails that I received. Mayor, Scott Anderson, Tracy, did you want to share your issues with us at this point, or can they wait to a later point?
Mine can wait, Chair.
All right,
Mine can wait also.
all right.
As can mine.
Okay, thank you very much. Mr. Connor.
Okay, thank you very much. And again, sorry for the late arrival last night. Dr. Ariola, Dr. Lemaster and I were still working on this thing into the evening, so hopefully you've had time to take a look at it. Just kind of want to roll through kind of the general layout of it and talk about some of the basic tenets that we feel like need to be in place. I'm going to start with the key points that will affect the recommendations moving forward. First and foremost, there's a lot about this virus that just isn't known at this point. Whether warm weather affects it positively or not, immunity, all the different things that you've been hearing about nationally. The second one is, and I think this is generally understood or recognized, that once you start to release the social distancing and gathering size requirements and start additional interactions, there will be additional spread. What we're doing today is really key on how that spread is determined throughout the community. Again, I think everybody's aware until there's a vaccine or other therapeutic interventions, we'll be dealing with COVID-19 for a while. And as we, sorry about that. So again, we wanted to make sure and emphasize the point that as we people start returning to work and travelers start coming to Johnson County, there will be new introductions of the virus in our county. Again, it's going to cause additional interactions with folks, and so there will be additional virus. One of the things that we feel very strongly about is the sorry about that, we're getting feedback here. We need to have a really robust surveillance public health system in place and to enhance our capacity to detect outbreaks. And again, I think it's universally understood that there will be additional infections that'll start to spread throughout the community. We feel like we have quite a few pieces in place, and I'm going to let Dr. Ariola talk about how he feels the public health system is in Johnson County. And as we start to go through the phases and start to do testing and surveillance and investigations, that we may need to reintroduce the mitigation measures if there's widespread transmission detected. So just wanted to make sure that's something that's kind of understood as we put this plan together. And the other thing that we think that's going to be important moving forward is a communication plan to inform and educate the community to increase confidence and belief that it's okay to return to work or to play or to worship. There's a lot of information out there. There's a lot of a lot of anxiety, and so we want to make sure that we communicate clearly, with the Johnson County community to make sure that we're doing everything we can to increase the level of confidence that it's a safe environment to start to work and to play again. I'm going to stop right there and ask if there's any questions about those 6 kind of tenets, and then Dr. Ariola, if you'd like to talk about the public health surveillance system.
Thank you, Joe. I'm happy to do that. It's tied to the process that the White House also released, but we were already thinking of this ahead of time, and I think I was talking about this also on Wednesday, which is we do have to be ready and to be realistic about what will happen once we start to roll things back. Where we are is a direct consequence of the shelter in place and other social distancing measures that we instituted. And we like the way that our numbers are trending. But once we start to roll things back and there is increased interactions among people, we expect more spread than we currently have. Our best case scenario is to have sporadic clusters that are restricted to maybe some work environment, some building, but the alternative or what is possible is that we even have a broader wide spread of the virus, similar to what we were having before or similar to other places, and we have to be ready for that. And to be ready for that is to be able to detect that as quickly as possible. And again, it's been emphasized in the White House document and all of virtually every document that's heavily tied to a very, very robust surveillance system, and that it's really testing. So testing resources has to be there, swabs and media, and then we have to have resources to do contact tracing, which becomes then our primary disease containment effort. And so it's our job to reformat our approach, and that's what we are presenting to you. Once we are relaxing the the shelter in place and physical distancing measures, the way to do that for us in terms of a public health approach is to enhance our capacities to do this. And so we, it's been done. There are countries where this has been their primary approach, but that is tied again to a lot of testing, and enough resources to do those contact tracing. And like Chairman Eilert said on Wednesday, we're working on developing a detailed budget of that. And my understanding is there's commitment to doing that. A big variable to our surveillance and testing thing is availability of swabs. And we're continuing to work to make sure that we are overcoming the obstacles that is presenting. But that is the biggest thing. Our numbers are trending well. We hope that there are no surprises in the next couple of weeks. But then to move from one phase to another, that has to be there. And to ensure that we maintain control over the spread, that has to be, we have to be sure that we'll have that.
Yeah. Thank you, Dr. Ariola.
Let me make this comment so that everybody knows. We have received funds from the CARES Act, the county has. And so as far as the capability to provide funding for additional testing, I don't think that's a real issue at this point. The issue is the availability of the materials to do the testing and the lab resources to analyze. So again, I want to emphasize at this point in time with the CARES funding, I think we're in excellent shape to provide the funding for the testing and for the tracking also.
And Chairman and Joe, Frank Link is asking in the chat section, I don't know if this is the time to address it or when you're done, Joe, but he's asking, has Johnson County already met the White House gating criteria?
Yeah, I'd like to get through a little bit more of this,
Okay.
and then we'll get back to that, Frank, if that's okay. Julie Brewer, you got your hand up. Did you have a question?
Yes, I do. I just have two technical questions just for information so I understand. If we were to reopen and there were to be a bump up in spread and we would have to kind of pull back. So as a small business or as a larger business, I've started to rehire and now I'm pulling back. So I may be able to furlough. I may have to, unfortunately, let people go again. What happens to that person who maybe already had filed for unemployment, went back to work, and now is in the same spot again? Is their status to apply for unemployment again impacted at all if I'm on the job for 2 months and I find myself in the same boat again? Is one question.
Yeah, that's a good question. I certainly don't know the answer to that, but we can try to research that.
Okay, so, and I think you can understand the parameters of that, because do we dampen maybe folks going back in the workforce if they don't think it's stable, or do we hurt somebody who does go back in the workforce and then we pace it as much as we should and now we impact them again? And then my second question is with I was able to view the meeting from yesterday, so I appreciate knowing that the dollars have started to come in. Where do we stand though for access to, and I know lab and materials are big barriers, but are we at a point yet where rapid testing is done, and how do we define rapid testing? I don't know what's the quickest turnaround response you can get in the US or around the world with this testing.
So let me just jump in just for a second. We have a lab under contract now that gives us a 12-hour turnaround, and it's here in town. So, and they currently seem like they have a lot of the supplies. On the rapid testing, Dr. Ariola's addressed this numerous times. I'm going to ask him to address it one more time, but pretty briefly on what your thoughts are about the rapid tests.
Right. The test that we're using is the RT-PCR test, and that is the test that virtually every place is using. There are recently approved tests for point of care, meaning if you have a clinic or a hospital, and that's different from what we use for population tests. The other question that's come up, of course, is around the antibody test, which is what I tried to talk about. Until that will have an advantage, but I think that will be in the future, both because they have to increase the specificity and the accuracy, and also because we're very early in terms of the percentage of our population that have been infected. So right now, the test that we have is probably what it's a pretty accurate test, and Joe just mentioned that the turnaround has really improved. We get the results back in less than 24 hours mostly. So that's pretty good.
Yes, but to answer the question, you're not planning on changing your testing approach at this point. So the rapid test isn't part of our thought process just yet, right?
That is accurate, yes.
Okay.
Well, let me emphasize, as I recall, one of the factors in making that judgment is that the rapid test may identify a positive, but it might be from one of the other coronavirus issues. Is that right? So that you don't know that it's the COVID-19 virus.
It is. I think yes. It has not been approved. It is not approved as a diagnostic test. It is, and that's the first part. The second piece is it's not accurate or specific enough. The antigen that's supposed to pick up the COVID-19 is also picking up other coronaviruses, and so if you can't separate the one that's COVID-19, it's not specific or accurate enough.
Okay, thank you. Scott Anderson, you had a question?
No, just real quick in response to one of Julie's comments. I laid off 350 people in Kansas. I can tell you that in Kansas, you have to make weekly unemployment claims. I brought people back to work for a week and then laid them off again. For the weeks they come back, they just don't file an unemployment claim for that week. And I can also tell you for the handful of lucky businesses that receive PPP money, they've got employees on the payroll right now really without much to do. So that's just my response.
Okay, thank you.
Thank you.
Looks like Commissioner Brown.
Oh, sorry, Commissioner Brown.
Just wanted to point out while we were on the conversation with Dr. Areola about the antibody testing, the governor of New York yesterday had announced that they had been doing some random sampling across the state, and that they had determined that 13.9% of their residents had coronavirus. Now, I also agree with what the chairman just said, that there are different strains, and that may mean a host of things, but it's interesting to me that in other parts of the country that they're moving forward on at least trying to unlock this. They're working on it. Just want to pass that on to the group. Thank you.
Yeah. Doctor, I think you indicated that there was a more specific process involving analysis in New York than what is normally done. Am I wrong?
You're accurate. New York and LA, they have both done this in collaboration with academic institutions. And again, you can have probably better confidence in the test that those academic institutions are doing better than the ones that we're getting from a lot of companies around here. Because again, a lot of those institutions have very high caliber laboratories. I know that Abbott Laboratories and at least one other company is working very hard to perfect the antibody testing. But again, doing it as a research project with a lot of caveats and questions as to whether they are specific enough and unsure of what kind of deductions you can make from those or what they really add to your body of knowledge. I feel pretty confident that it will be useful when infection rate in the population is in the 50%, 60% range. Right now, it's hard to imagine for a test that is not approved, for a test that is not specific enough to imagine what is really adding to our body of knowledge. I remain open to that. I want to make that clear. But I know enough about it to know that it's not something that I will waste a lot of energy on right now.
Okay, thank you.
Thank you.
Mr. Connor, continue.
Sure. So we'll go on to the next section of the document. And this section is intended to say that, kind of during all times during this rollout, we need to have some basic things that'll happen no matter what phase that we're in. We're talking about, perhaps requiring citizens to wear masks. I know that some businesses are requiring it, but we may want to talk about that, with the washing the hands and social distancing. Try to avoid the crowds or limit close physical interactions. Continue to encourage citizens not to embark on necessary travel. And then again, continue the quarantine requirements. Continue to restrict visits to our long-term care facilities. I think that's been very effective, especially here in Johnson County, and we want to continue that. And then continue to encourage the high-risk residents, and like example, those with immune disorders or the elderly, to continue to stay at home as much as possible. Continue to plan and provide protection for our other vulnerable populations, and then work with employers to encourage telecommuting and to continue to do some of what they are currently doing, because again, we feel like those measures that have put in place are actually working from a public health perspective. Any questions about that section? Scott, did you? I see your hand is still up. Did you have a question there? Or?
No, sorry, that's my error.
Oh, okay, thanks. Oh, Chief Reddick.
Yeah, I think this is a point I'd just like to say when we go down this road. I see you have in parentheses perhaps require on the mask. I just think it's important for everyone to think about, for our perspective from the enforcers side of things, that when we put require or mandate or any type of wording like that, we're getting phone calls asking for us to take action when people see that. So like I said, one way or another, I think you need to consider that as we put things into our plan, that aspect of things. We've had phone calls that range from, I think somebody had a phone call regarding two people riding in a car together and they were violating the social distancing. So I just think we need to be careful of that as we're wording things and what that means to our citizens as we go forward. That's all I had to say. Thank you.
Thanks. Good point.
Okay. I don't see anybody else. So let's start talking about the phased approach to recovery. Again, we're trying to reemphasize the fact that once we start to do this, there will be expected increases in COVID-19 spread, and this is we're using the term trial and error, but just because we want to be able to open things up, we want to be able to measure what's happening, and we also want to just determine if we need to roll things back. Again, if there's significant community spread that's detected. On the duration of the phases, we're proposing that there's 4 weeks in between each phase. That gives the public health system time to again continue to evaluate where we are at with the gating criteria, and looking at spread of the virus, impact on our vulnerable populations, and monitoring the hospital capacities. And if there's any questions on that, I'll ask Dr. Ariola to kind of speak a little bit about from his perspective, what he's thinking about with that 4-week proposal.
Thank you, Joe. And I've had these conversations. I am still open to the timing. I, at this point, have questions about a 4-week time period between phases. I understand the principle that's being talked about, but for the 3 phases, you're really talking about 3 months to complete. And I'm not sure that that's the time period we need to embrace. But Dr. Ariola, I'm willing to be convinced and be glad to receive your comments.
Yeah, thank you, Chairman. The primary premises there are to, that includes factoring in at least 1 incubation period. I think you've heard about the 14-day piece, but it's also to give us enough time to see, hypothetically, when you roll things back, if you think like you have a week to see if there are increased infection, for those infections to manifest and for us to be able to track and monitor the changes, the least you can do to expect any impact will be 3 weeks. And so to track and monitor that is really why the 4 weeks is there. Again, if you, because the plan, even from the White House, does call for multiple gating criteria. So before you proceed from phase 1 to phase 2, you have to make sure that you meet those gating criteria. So you have to give yourself enough time to do a robust testing and tracking that you can justifiably defend and say, we have met this to proceed. Is it etched in stone? No, maybe there's some overlap that we can see, but I'll take another look at our timeline. But to give the changes enough time to make an impact and for us to be able to track those impacts, no question, it will be close to 4 weeks.
Thank you. Becky Yoakum, you had your hand up?
Yeah, I just was going to point out that I thought that the way Nashville approached this in their plan was good. It didn't have a definitive time on the phasing, and it just said after improvement or stability for 14 days. And so if that ended up being less than 4 weeks, great. If it ended up being more than 4 weeks, whenever you met that criteria, and that, I don't know, it's certainly less definitive, but it is maybe a little bit, gives you a little bit more flexibility without really tying yourself to the 4 weeks.
Yeah, Areola, again, thank you. Excellent comment. I actually spoke to the folks in Nashville yesterday also. And I promise you, it's the 14-day thing is very similar to what we're currently doing. It's asking you to watch the trend for 14 days like we're doing. In theory, that if you get that in 4 weeks, that's overly optimistic. But maybe that's the right approach, not tie ourselves down, but conceptually just understand that in practice, that's probably going to be longer than that. But yeah.
Okay, Mayor Michelson?
I just want to echo and agree with Becky's comments, particularly because of the possibility that we might have to backtrack on this at some point. So I like for this draft, maybe staying away from a number unless it's qualified and hedged more than this statement has right now by those possible variations.
Okay, Tracy Osborne?
I think I'll join that choir of the mayor and Becky and the chairman. The feedback that we've received from our businesses is that, you know, while many of them do not believe that they're ready to open on May 4th, unless there is, you know, a very, very significant decrease in, you know, all of the instances, most of them want to make very sure that we're on that downward trend because most of them really do not want to have to experience the pullback, especially those that are teetering on the edge. You know, many of them just don't think they'll survive a second closing. And so, you know, but we did have a little bit of time after we received this draft last night to send it to all of the chambers, send it around to some of our businesses. And I got quite a bit of feedback late in the night and early this morning. And there was a lot of pushback on a definitive 4-week between the phasing. So many, you know, have read the 14 days with all of the other national models that are out there, or, you know, like the idea, you know, that Becky has floated about being, you know, just a little bit more flexible with that. You know, there's no one that suggests that we need to be aggressive. Taking 3 months to go through all of these phases, I think is a little bit too conservative.
Okay, Commissioner Hanslick.
Thank you. I wanted to echo what Tracy said because I've talked to a number of businesses in my district, and I'm hearing the same thing. People are saying, we do not want to do this too quickly. They want to make sure that they can build customer and employee confidence in the system. I know there are folks who are afraid that if it feels like this plan is pushed through and is on a quick timeline, that people won't come to their businesses anyway because they won't trust this plan. And I think another important point to think about too is that national polls, and certainly I think from what I've been hearing from my constituents, is that Americans are overwhelmingly support continuing these stay-at-home measures until they feel it's safe. And again, I think if we push this through too fast, we will have lost the confidence of consumers, and they won't be utilizing restaurants or other places anyway. So I agree, we need to take this very carefully.
Thank you. Commissioner Brown.
Thank you. So actually just a couple of 3 or 4 comments probably. I hear from constituents a very different line about this. I've heard a couple of people talking about whether it's conservative or not, about whether, a 3-month timeline or a 2-month or some arbitrary number. But to address Commissioner Hanslick's comment, she said specifically that we would do harm to ourselves if we opened up and people don't come to the restaurants. And I want to point out to everybody on this call, we, as far as I know, except for Scott Anderson, don't have any investment in that restaurant. It's a business owner on that restaurant that has everything they own on the line to securitize the facility, the rent, the taxes, and the employee base and the contents, the FF&E within that structure. We don't have anything in that except a vested interest as the county in collecting property tax on it. So I have an issue with who's we on that. Second, I'd like for Dr. Arola, if you could, to define for the group, what does the word safe mean? I'd like a definition of what is safe, a threshold for what is safe.
Is the and I get those questions for different scenarios. I think for the most part, what my preference is always to say that there is no significant risk, or the risk is low enough. There are no absolutes anywhere, but there's a threshold where we can say the risk is not significant, and some people will choose to call that safe. I guess if you are more specific with your question, I'll be very glad to answer that. What we typically do, and you'll see that in this document, is do what we call risk assessment. And we make our assumptions very clear. That's why you use assumptions about where we are, what our numbers are, what to expect in the future. And then based on those assumptions, you make clear what the level of risk is. That's what we're essentially doing, and using that to classify things into different phases, and then augmenting that with risk management or risk mitigation, risk reduction processes there. And so there are no absolute safe out there, but we can reduce the risk even in some of the essential services that have remained open. We have put in place risk mitigation processes, and that's what mask is doing. That's what physical distancing is doing. So I would say that when most people use safe, they're basically saying that the risk is at a level that is tolerable.
So, okay, so thank you, because that was exactly the summary right there is where I was going. So the risk is assumable. You know what you've calculated the risk, and whoever they is, the person decides to go to the grocery store or go to a restaurant or drives a car or gets on a golf course in a thunderstorm. There's some risk you're taking in doing that, and you're calculating that risk, and you're balancing that against the reward of whatever it is you're out for. So what I heard you say, Doctor, is that there is no such thing as safe equals no risk. That does not exist in this scenario right now because we don't have a cure. There is no vaccine. So there is not an equation between safe and zero risk.
I will say that again, when we talk about risk, we look at, I think I know what you're saying. We look at risk as a function of exposure, but also as a function of the characteristics of the issue or agent that we are dealing with. And so the type of virus itself or the type of incident, you have to consider that. And then you have to consider what is called exposure, which is opportunity to be exposed to that. And then, of course, a third variable, which we always factor in, is the perception of the community and the tolerance level. I would say across the country, and that's what you are hearing from people, that a very large percentage of people are still concerned about the spread of the virus, the innate property of the virus itself to cause harm is part of the risk assessment, and of course, the possibility of exposure. So what this virus, when you are looking at risk from this virus, it really is different from driving or walking to a grocery and say there are elements of risk there, because exposure and the innate characteristic of the virus to cause harm has to be a big part of it. And those perception issues are also different for those things.
Okay. I think I understood what you said. So just, and then just one final thought, Chairman. So I have not heard from one business owner in my district that has said, please keep my business closed. What I have heard from is a lot of individuals who have said they're concerned about safety and they're concerned about things opening and opening too fast. And I share some of those same concerns, but I also recognize that we've got small businesses that are literally going bankrupt and they're going broke, and we've got to continue to figure out a way working toward what we're doing here and getting them open. I guess these are huge corporations that are saying, please keep us closed, because I don't know a small business in my district that has said, please keep us locked down. They're desperate to get open, and they're willing to go along with just about any set of guidelines simply to get some revenue rolling so they can start paying their rent again. Thank you.
Okay, thank you.
So before we leave this point on the duration of the phases, do we want to, oh, I'm sorry. Who? Oh, Scott, I'm sorry, Scott Anderson. And then Julie Brewer, sorry.
Real quick, I just want to echo Commissioner Brown's comment. I'm getting bombarded by people I've never spoken to in my life that found out I'm on this committee begging and pleading to let us allow them to do some kind of business. I don't know. I mean, I literally talked to almost every restaurant owner in town, and I don't know who's saying keep me closed. At the same time, I think these people are very reasonable. Nobody's asking to fill their restaurant to capacity. No hair salon's asking to fill every chair in the place. These people are saying, just please let me do some business. Let me have somebody in to generate some revenue to at least pay something. And I think these business owners are extremely reasonable in the restrictions they're willing to live under, but they're begging and pleading to do some business.
Thank you,
Yes,
Scott.
yes, I think most of us received those comments also. Thank you.
Julie Brewer?
Subsequent to our first meeting, we did a brief 3-question survey of our nonprofit community. And so I took a little bit different look on this. So I don't really, whether it's 14 days, whether it's 4 weeks, I think there's been very good points made on all sides. What we actually asked is, what would be the advance notice needed for agencies to return to work? So in other words, whatever we do, I think we do have to have some clarity in when one phase begins and when the next phase looks to begin, because we have to think of the practical things of what I need to do to be able to ramp up. And in these cases, it's agencies who had to suspend and lay off maybe some of their employees, but still do some of their work. And I will say about half of the respondents indicated, anywhere from less than a week to 1 week notice, just so they have enough time to pivot and be ready to open. But I would say clear communication as we move from one phase to another to allow organizations and businesses to be ready. So when they're phased in, they're ready to open. I'm sure there's, especially for for-profit businesses, there's a certain amount of competitive advantage to having that clear communication.
Okay, thank you.
Becky, did you have another question? I see your hand is still up.
No, I'm sorry. I just forgot to take it down.
Okay. Well, I think we need to come back and talk about the kind of the duration of phases. That was great discussion on that. But why don't we move into...
for Stan.
Oh, I'm sorry, Stan Holm. I'm sorry. I didn't see your hand up there. Apologize.
No problem. Thank you. I just thought I'd add, we need to make sure, first on your universal precautions, I think your wording on encourage is something we should pay close attention to versus the word required. As we look at, enforcement, as we already talked about, the availability of PPE, as you look at the transitions going forward with a lot of variations to the word required is a big deal. I also would share that as we develop this, it's very important as a task force that we keep in mind, and I think it was brought up several times, but just to put it out front, that there will be natural human behavior from businesses to ensure they protect their associates and their patrons. So there will be natural phasing in. I think Scott even mentioned even their own associations are recommending how they can phase that in. Then you have the patrons themselves that already have fears that will be looking to make sure when they come into those environments that they're looking at what you put in your universal precautions and have those businesses done that correctly. I would just encourage us to make sure that we keep it broad enough that we listen to our constituents that are saying, keep us safe in what this task force comes out with, but also recognizing there will be normal human behavior from the businesses on how they're going to protect themselves with their associates and making sure they can take care of business in future days, future weeks, future months, but then also the patrons for each of those businesses cautiously coming into those environments. And we don't have to look any further than what we see in gas stations, Walmarts, and other locations for which you saw that transition of individuals naturally keeping that 6-foot distance, naturally wearing their own barrier masks and finding ways to ensure their own protections. And we need to keep that in mind too, that it's not that stay home meant that we all have gone to these different locations. And as we put our plans together, let's just keep in mind there's already segments of where individuals are social distancing, but also out in our public environments. And again, just broad stroke, we should look at the words encouraging versus restricted. And then I would also agree, just one last thought, that trying to put specific timeframes, like even with the words about 4 weeks or 2 weeks, let's let some key indicators trigger the next steps. But even in that, the thought of what you're seeing with trend lines going down, I think it was brought up, Joe mentioned at the very beginning, or Mr. Chairman, that it's likely when these populations go out that we will see waves. I think from the health system's perspective, the fact that we have avoided this incredible peak that was, 5 weeks ago, 4 weeks ago, and even 3 weeks ago, when all of us started realizing that moderate curve is there, we all also in the health systems are still expecting, as everybody opens up, to still have waves. It's just, we do believe that the phases we put in today, the phases that associations are putting in, the natural human behavior of how the businesses and their patrons will react, I think comfortably that we should recognize that there will be waves, but there will be softer waves as we approach this. I just want to put more comments out there for us to consider as we try to finalize this today and Monday.
Okay, appreciate that, Stan. Okay, so moving down then into the parameters and criteria for determining which business will be in which phase. Again, what we tried to present to you, again, and this is just a draft, but what we tried to present is just based on, as Dr. Ariola mentioned, level of risk, which makes the environment safer. So again, going through the symptoms, cases in hospitals, the gating criteria, and then start talking about phases. So in phase 1, that's where we're currently at right now, and then so we're continuing to do what we're doing, have the stay-at-home orders in place, the additional testing of the special groups, and trying to confirm that what we've done so far has flattened that curve. And phase two will be the first section, the first group of businesses that, again, at the kind of at the lower end of the risk spectrum, that are very adaptable and can put in place steps to reduce the transmission. So I think, as looking at the bullet points there, this is just a jumping off point for discussion. Any thoughts or comments on what phase two looks like? Mayor Michelson.
And if it was mentioned, I missed it and I apologize, but can we revisit the question for you, I suppose, Doctor, as to whether we've met those gating criteria? And if not, how close we are at this moment in time? Is that an appropriate time to take that question up?
Dr. Ariola, I'm happy to answer that. I think we are trending pretty well. We are trending downwards. And unless something drastic happens, I feel pretty good about how things are. And so the 14-day criterion we haven't met, but if we continue along this path, we will meet very soon. Our numbers are trending downwards. Yeah.
Okay, so if I understand it correctly, we're very close to meeting the start of the 14-day criteria. And then under the recommendations, it would be 14 days from then that we would enter phase one or the next phase. Am I understanding that correctly?
No, the 14-day criteria, what they call the gating criteria, is happening in our current phase, what we call phase one. And so,
yeah. When did the 14 days start then, if it's already started?
We really started trending downwards about a week ago, maybe slightly longer, but you can see the downward trend pretty clearly for the past 1 week. And feel free to go to the joko.gov.org website and look at our trend lines there. You will see the 3-day, 10-day average, but you also see the influenza-like illness. I don't know if I know. Maybe later, Joe, you can also share that website. But the trend lines are pretty clear that we are trending downwards.
Well, Doctor, let me ask this question then. When does a 14-day period end, based upon current trends?
If you give me a minute, I mean, I don't know that I can be that specific yet, but
is it next week? Is it May 3rd? Is it May 10?
And I guess I would just ask: is there something that we should be consulting with our health officer about also?
Right. So I don't know that we can get into dates. Because again, so the language from White House is either it's flat or trending downwards. So I'm sure that, when we were presenting to the board yesterday, you know that those data, it's not like elaborate, it's not always linear, and so you get ups and downs, and those are always there. And so I would just say, let's continue to watch those data. Let's see what it does like next week, Monday, Tuesday, and then it will be clearer. But for the past few days, I've been saying publicly that our numbers are clearly not getting worse, which means that at the minimum, it's flat, but they're for the most part trending downwards. So, yeah.
Doctor, let me ask you this. Perhaps you can consult with Dr. Lemaster,
yes,
and at our Monday meeting, maybe give us a little more clarification on that.
We will try to do that, yes.
Thank you.
And if I may, Chairman, one follow-up question that maybe we'll need to come back to as well, but that is your and Dr. Lemaster's level of confidence that we are doing enough testing such that those trends are reliable for this purpose.
I will say that we have additional testing that's going on, and we have some planned for next week, Tuesday and Friday. When I proposed this to the board about 3 weeks ago, it was intended for us to get 3 or 4 data points. And so I think you just hit the right point, the right nail on the head, which is we need a few more data points to confirm that the trend is truly what we are seeing, and that's why it's tough to pin ourselves down to one, to some dates. I like where it's trending, but we need a couple of more data points to support that. In terms of in terms of the coverage of our testing, I absolutely love the way that we have done it. Like I was saying 2 days ago, we're looking at our general population, the people that we have asked to stay at home. We're looking at our essential workers who have been out there in our grocery stores as part of our first responders, delivery drivers, our custodians. We're looking at people in our long-term care facilities. And so we're trying to capture all of these different groups to see what's going on. They're trending well, but we need a couple of more data points to confirm that.
Okay,
I guess that's your point here.
Chairman, what Sami and Joe and Dr. Lemassa are working towards is a recommendation to the board by Tuesday. So I'm not sure where he'll be on Monday for this meeting because we'll have to have that discussion with our board as well. So next week for sure, not sure exactly when. So
Okay.
more to come.
All right, thank you. Joe, continue.
Tracy, you have a question?
Excuse me.
Yes, thank you, Joe. Just a quick question. It's probably really more one of semantics or definition. The feedback that I had from people who looked at the plan, and it really kind of goes to the heart of, are we in phase 1, or, when will we come out of phase 1? So it seems like phase 1 is continuation of stay at home, or maybe it's called watch and wait, because I think a lot of other states or counties that have started phasing, when they say they're phase 1 actually means a number of businesses start to come back open again. And so I think when we talk about clarity of communication, people have an expectation that someone's going to start opening. Certain restaurants have an ability to have X number of capacity, and certain small businesses are reopening, or whoever we put into that phase. And so, if phase 1 really is now, maybe we're just continuing our stay-at-home orders and we're watching and waiting, and we actually rename phase 2 as phase 1. And
Understood.
re-clarify what we're currently doing, because the people that I've feedback from today, and even last night, were really kind of confused about what that meant.
And I will add to that one, the one that I looked at, I think it's Nashville, had current phase. And then, like Tracy said, phase 1 was actually when you start rolling it out. So clarity is definitely needed.
Yep. Good point.
Yep, thank you.
Thank you.
Commissioner Hanslick?
Oh, thank you. I was just going to say what actually Penny Post Oak Ferguson said, that in the Nashville report, or the Nashville roadmap, they call it present day. And then phase 1 is when some of the restaurants start opening up and some of the other businesses. So I agree. To me, phase sounds like something has started happening. So perhaps we could use a different term for present day or current situation, whatever would be appropriate.
No, that's easy enough to change. Thank you for the feedback. Okay, I think, Tracy, you've already asked your question. So anyway, moving into, what phase 2 looks like, or I guess we're going to call it the new phase 1. Continue to prohibit large gatherings and limit socialization with vulnerable populations. Allow more daycare centers and schools to open. Bars remain closed. The restaurant can open at 50% capacity. And then small businesses with less than 10 employees can open if they maintain physical distancing measures. Again, thoughts on kind of the kind of our jumping off point to discuss the first round of folks to open.
Let me ask this question. I've had several conversations with hair salons, barber shops. As I recall, the John Hopkins, those were in later phases. Is that right? And I guess if that's the case, I would hope that we could look at some requirements that associate with personal protection of the provider and the customer, as well as distancing. And I know shops may have chairs that are closer together, but some alternatives to every other chair or something like that, which might provide a proper level of protection for the providers as well as the customers.
Okay. Scott Anderson?
A couple things. One is I think we need to address the bars question that I'd placed to the group, but that's not a high priority. And I'd also echo the chairman's comments. Beyond restaurants, probably the most comments I've received about any industry are hair salons and barbers. I would really like to see some kind of service being able to be done in that segment. We hate to see it, but it's the truth. I know there's some of these people are going from house to house right now doing hair, cutting hair. I think it'd be a safer environment to have them in their salons with minimal customers where it could be more sanitary. So I'd really like to see that one addressed too.
Agreed.
Okay, thank you.
Becky?
Yeah, a couple thoughts. One, I actually was going to mention the bar question that Scott raised earlier as well. I agree with him. I don't really think that we have many, if any, bars in Johnson County. I think most of the businesses here would qualify as restaurants based on their food sales. In that same bullet point where you talk about being monitored, I'm just going to echo Chief Reddick that we have some concerns about who does that monitoring. And I think that that's going to be key in terms of enforcement. And we really need to put some provisions around that because that will be very difficult for local law enforcement to do. And then the last thing is in D, you mentioned small businesses with less than 10 employees. And I just wanted to clarify if that is intended to be any small business with less than 10 employees or just the ones that are in the chart down below.
Well, I think the intention was that if it was any small business with less than 10, and I guess Sami, help me out with that one.
Yeah, that's again, these are drafts that we put together, and that's really just saying that it's impossible to define this for every business and every sector, but to be clear about what the intentions are, that what we know about the spread of COVID-19 is when people get together, a lot of people in a small space for a long period of time, without the ability to maintain the physical distancing measures, the risk is higher. And so that's really a broad stroke. That can be, I think that's broad. We can define that further because a lot of the salons and stuff will probably fall under that too. So maybe we take that out, but that's really just trying to say, hey, here's the intent, understand what we're trying to do. If you have a large group of employees and customers coming in, the risk is higher. And since we are easing ourselves into this, we're really just looking at, for now, businesses that will not present that kind of problem to us.
I actually like that it includes all businesses with less than 10 employees. I do think, though, that perhaps we should think about businesses that have perhaps more than 10 employees, but can still do the physical distancing. I think that you might find that there are larger employers who have the ability to physically distance in a way that would allow them to open as well. So just throw that out for food for thought.
Thank you.
Thank you. Tracy?
Yes, that was actually my point as well. I've had feedback within our own membership base as well as other businesses throughout the county through the other chambers that I think you'd be surprised at all sizes of businesses who have been anticipating this day. They have been preparing for social distancing, whether it's through multiple entrances, if they have a number of employees. They've already worked at spacing out the workstations, moving and creating barriers. And so, I think as long as they can maintain those distances, we might want to reconsider the businesses with less than 10 employees. Many of them have already created additional shifts so that they can maintain that space because there aren't a number of people who are coming in the business at the same time. I think we might want to maintain some flexibility there. At the same time, some of them are already working and they may choose to be remote, and we should continue to encourage that. Those that can should do that, but there are some that simply can't do their work remotely. And for those, we need to make it available for them to get back in business as quickly as possible. They may be in manufacturing or distribution. Those people need to be on site, and then their office workers could still be remote and at home. And then through that, they could maintain social distancing even throughout the summer. Back to the restaurant piece, the one piece that I've heard as a question that when we go back to Scott's bar question, breweries, we need to specifically address those because I did have that question from a couple of businesses. And I think, the other thing that I wanted to ask about was the enforcement issue. I had a couple of, even in the office space, they said, is someone going to, are we on our honor to do that? Or, is the county producing these guidelines, or are they asking us to look at our own industry standards and then, we're good? Or is someone going to come around and inspect us? I think we just need to provide clarity as a government as to what that expectation is. And then, is there enforcement on the other side? Or just what does that expectation look like?
Okay. Thank you.
Mayor?
Thank you. I agree that a flat 10 employee test seems too rigid on businesses. It seems from a health perspective, and doctor, correct me if I'm wrong, it's more about, maybe how many people per square foot are in your business. And you could have a business with 8 employees in a very confined space that's going to be more dangerous than a business with 50 employees scattered over a giant facility or 3 different facilities. So I'm not sure that 10 employees flat is the right test. I want to for that. The other point on this same provision D that we're looking at is should we expand the word businesses to include nonprofits? And Julie, I see you shaking your head. Yes, maybe you agree with that. And also government non-essential functions that are closed currently. And here I'm thinking about walk-in permits and so forth from City Hall, municipal court. There's a big question mark right now for cities as to how they can reopen our municipal courts. And another category that I don't see here would be pools. So maybe government facilities could be included in that definition somehow or addressed separately, because there's a lot of talk going on right now, including I know a countywide parks meeting going on talking about pools, I think, as we speak. But uniformity and direction from this task force, I think, could go a long way in those areas as well. Thanks.
Thank you, Mayor. Okay. Scott?
I agree with everything I heard. I'd just like to, if we go with a number like this, I'd like to add the word locations after businesses, or basically make it clear that if a business has multiple locations, but 10 or less, whatever the ultimate number is, at any individual location, it applies on a location basis. So just to make that clear.
Very good.
Thank you. Commissioner Brown?
Thank you, Joe. So I agree with everything that I think every single word that I just heard Tracy Osborne Olchen say and Mayor Michelson. Those are the kinds of things that are going to get us all rolling in the right direction. I originally put my hand up to address the issue specifically of enforcement. That word can be defined in a lot of ways, and what I am more interested in seeing from an enforcement standpoint is not a hotline for people to call in and tattle. And I'm not interested in a heavy hand of law enforcement, whether we're talking about local at city police departments or sheriff or highway patrol or any other law enforcement arm, I'm most interested, that is not a heavy-handed approach. I think that creates a backlash in the community that would be detrimental to everybody involved in this. And I do mean all 600,000 of us in Johnson County. I think it puts us all in a bad spot. That said, I think that law enforcement needs to be a whole lot about education and awareness and making sure people understand what the rules are. And again, then what Mayor Michelson said about the 10 employees, I think that's an arbitrary number. I think it is a number of employees by number of square feet available. I also think that there has to be some measure of common sense in this. If you are scared to go back to work, I, as an employer, if I have someone who works for me that's scared to come back and can work from home, I'm going to encourage them to work from home. If they can do the job from home, then work from home. But that flexibility needs to be provided. But there also needs to be more than a hard number on a lid. I can think of one particular business that has over 30,000 square feet of office space. To put 10 people in there would be ridiculous. That's not open. That's skeleton crew taking up a little bit of space. So I think we need to think that through carefully, that it's a number of people by square feet. There is a divisor, and we need to figure out what that is. But to put a cap on it, I think is a mistake in a total number of people. Thank you.
Thank you, Commissioner.
To the question of enforcement, I just want to emphasize, up to this point, it has been based upon education and information, and I would hope that that's the same process going forward.
Yes.
Chief Reg, I guess I'd ask you to speak to that. I know over the last 5 or 6 weeks, you convened a meeting of the sheriff and the chiefs of Johnson County, and included our district attorney. Can you speak a little bit about kind of what you guys' plan moving forward was?
Absolutely. I'd be happy to. I think I mentioned that in our last meeting. We've been, as you mentioned, we've been meeting regularly. The consistent communication has been education, with very little pushback from anybody we've contacted on the education component. I don't see that changing in any way, shape, or form. I think it would be they turn that law enforcement in Johnson County is not interested in any way, shape, or form, is going down the enforcement route as a priority. So I think that's going to continue. I'd be more than happy to answer any more questions with that on the particulars of how that would work, but we're all on the same page, that meaning the DA's office, sheriff's office, and the locals, on how the enforcement component and the education components worked out. And I was just I had already had my hand come up before the education or the enforcement aspect came up. I was just gonna echo, I think, what everyone else is saying and ask what the driving factor is when you're looking at the 10 employees. I think from what we heard from Dr. Ariola was the risk criteria, the close contact was the driver and what we should be looking at. And I don't know that the 10-person component fits into that. I think if we should be looking at how do I word that, social distancing components that the businesses are able to put in place, as opposed to just a cap on a number of employees. That doesn't seem to make much sense to me.
Thank you, Chief. And I guess, can I ask you, Chief, as this plan gets closer to fruition next week, maybe a reconvening of the DA and the police chiefs to kind of go over this, and I'd be glad to facilitate that with you.
Oh yeah, we have a regularly scheduled meeting every Tuesday, and if need be, and in fact, I'll probably go ahead and reach out to them today and go ahead and try to move that up into Monday and try to get that going so everyone's on the same page. I'm not hearing anything here that would lead me to believe that we're going to change our plan of action, but of course I'd like to talk to them about that and what that would look like for everybody.
Thank you, Chief. Commissioner Hanslick?
Thank you, Joe. I have a question, kind of looking at this from a broader perspective. how many phases are we potentially anticipating? I think in the draft, we're looking at 3 phases that would involve opening up. And just so I have a sense of what would be, for example, in the last phase, I'm from the business group categories, I'm suspecting it would be things like theaters or large venues, the things that are rated as a 3 under consensus risk category. But maybe it would help me to hear from other folks in terms of what would we see then would be in phase 2 as a broader outline before we go into a lot of details on numbers of employees and that kind of thing. That would be helpful to me.
Well, let me ask this question that we might be able to gain some insight as we move through these additional rankings that are part of the report. Is that possible, Joe?
Yeah, I think that is possible. We've got 2 other hands up too, Frank and then Stanholm.
Thank you. I just wanted to sort of join in with some of the others and say that to the extent that we can create a more simple rule that's sort of based on science around maintaining a 6-foot distance and giving businesses the flexibility to figure out how to do that distance between their patrons and their workers and other workers, and so on. And where that's not possible, like in a hairdresser, where there's some sort of barrier, that we could, don't have to be too prescriptive and leave it to the businesses to have some flexibility about how to accomplish the ends that we set out. And I think that helps with communication if it's a sort of a simple rule, without having to say, well, in this case it's this, and in that case it's that, and then it becomes it appears too heavy-handed and ends up causing more confusion.
Thank you, Frank.
Thank you.
Stan?
Actually, mine ties a lot to what Frank was just mentioning, and that's that a lot of our documents look at small businesses, but then the other reference to the word large is really large groups, and that's the visualizing groups of people gathering, but we really don't address the difference between smaller businesses and large businesses. And then back to Frank's point and how we look at it, healthcare systems, obviously we're large businesses and we get special consideration, obviously, for what we're doing in this crisis with what that looks like. But if I look down the street of me and looking at Garmin, for example, I know that they're wanting to reopen as well. And back to Frank's point, and I think I'd encourage us to think instead of terms of small businesses, certain number of associates or less, that we really do allow the businesses, no matter what their size, to accept some of their own accountability for the 6 feet, for their protecting their associates, for the wipe downs, the sanitizing. They're going to naturally want to protect their workers so that they don't send them home in a week or 2 or 14 days later, and then they're quarantined through natural processes. I think if we give them that flexibility, we probably need to look putting all of those different businesses in the same bucket. That's what I would encourage. And Scott even mentioned some of that before about how there's just natural things that businesses are doing. And Tracy mentioned she's hearing that from all her different size of constituents that are businesses. I would just have us also look at some of our criteria where I see small businesses, but I really don't see us in any phase looking at large business. And I would just encourage us to get away from the small versus large and let them have the ability to monitor that with still using our recommendations and encouragement through our plans, through universal precautions, and taking some of the specific best practices you see from other states and our state, et cetera, if I could recommend that.
Let me throw this out on the table. Ed Eilert, someone who had a higher ability at math than I have, mentioned to me a couple of days ago, they were working on this, said 10 square feet means that is the area that you need to be able to guarantee distancing opportunities, and that they were looking at that measurement as to present that option to businesses that, based upon your total square footage, and that 10 square foot requirement. I don't know what that does to businesses around our county, but, that's a possibility perhaps.
Thank you. Dan Robeson?
Thanks. I was just going to mention along those same lines, I know a number of other plans that we looked at that used the concept of different levels of capacity. So they'd established that, there's certain physical distancing that everybody should maintain, but then allowed for in these different phases, discussing, different groups, opening up with 1/4 of the capacity, half the capacity, 3/4 and full. Just another way to look at it.
Thank you, Dan. Well, why don't we maybe jump down to the table? I think we're getting into a lot of that's kind of the next place we need to kind of get to. So, so this is again our kind of our attempt, and when I say our, Dr. Ariola, Dr. Lemaster, and myself, to kind of go through the criteria that we talked about yesterday, 2 days ago, with the Johns Hopkins report, and try to put some framework around the risk categories of the different groups that were there. We've already heard some comments about maybe changing the groups around and maybe making some different classifications, which is understandable. But again, from a discussion standpoint, if you've had a chance to look at the table, we've got the risk category of 1 means we feel like that's the lowest risk, moving up to 3, which would be the highest risk. The only thing I would say on the outdoor venues, those are really more of the sports and entertainment type venues. So just to try to provide some clarity to that.
And Joe, if I can add something to that?
Yeah, please.
Okay. So if you look at the salon, spas, and other personal care, the consensus risk category of 1 is probably different from what you see in other plans. But if you were to look at, as we've listened to all this conversation, if you look at the ability to modify what they do, which is what you have under the risk management mitigation, that's where you're going to be able to help us out based on your understanding of these different business groups. If they wear their mask, if they operate by appointment only, if clients stay in their car until it's their turn and there's frequent hand washing and disinfection, and they reduce the number of chairs that they have, effectively they're reducing those risks. And so and I think that's what I've been hearing all day. So maybe there's a lot of things that will be in the appendix with this. I think Scott talked about the restaurant industry and some of those. So none of this risk characterization is really etched in stone. Those risk levels can be mitigated with the appropriate processes. And so this is really meant for you to start conversation around. And I've seen the Nashville and so many other things. I think people are just trying to make decisions on what we think presents the highest risk of people congregating together. But as you can see, there are so many variables there.
Thank you. Got a couple hands up. Tracy?
Great, thank you. Just a couple of questions, and I don't know if this is first for Dr. Ariola or someone else, but I think it speaks to clarity in terms of guidelines, and maybe that's, really all of us. Initially we talked about maybe plugging in industry guidelines, as a click through for each one of these as we encourage businesses to open up within the phases. But I had feedback. We hosted a couple of industry roundtables yesterday and even this morning in advance of this call. And so some of that feedback was specific to what the expectations are. And so some coming from salons, and then also from restaurants, in terms of, I think it really speaks to what Stan talked about on Wednesday in terms of the types of PPE. So, a salon owner can control the masks that his own staff wears, but, has no idea, if a client provides their own, if it's the mask that they've been wearing to the grocery store for the last 3 weeks and they haven't washed it once, or if the expectation is that the salon owner would need to provide that. And then if so, is that a medical grade, or is that, simply a barrier, like we talked about on Wednesday's call, and in which case that lowers the cost. And so, I think we've just got to be really clear if we're going to suggest, so that they can be in the lower risk category, thus opening up as soon as possible, and what the expectation is for them. So that they can just know what the rules are and be able to explain those to their clients and also to their staff. So, that's just something, I don't think we have to answer that right now, but those are the questions that I'm starting to get.
Right, but what I'm hearing you say is that you would like to see that some kind of reference material be included in the recommendation that we're making, right?
Absolutely. Across all industry types, I think what they're asking for, just tell us what the rules are. Tell us what the guidelines are. So if the guidelines are, like I thought Scott put together great guidelines that are very much in line with, say what the Restaurant Association is preparing on the Kansas side and the Missouri side. I thought his were clear and very succinct. So, we link to those and say, these are the guidelines under which you operate. I understand the Board of Cosmetology, may have good guidelines for that industry. We've seen some guidelines come out from, different sectors for, office. And so, maybe we select, that, from one of those sources. So I don't think we have to be inventing those, but we've got to select something and say, we believe this is good guidance for you. And that speaks to the enforcement piece. If we're not being prescriptive, we need to at least provide guidance.
Right, and that would be a public facing, which would also help with the public's knowledge of how the business should be operating also.
Yes.
Okay, thank you. Mayor Michelson?
Thank you, Joe. Two suggestions for you and the group. One is, I believe this graph and these categories came from the Johns Hopkins report. And just as when I read that one, there were some significant omissions that I'd like to see added. And to the extent that Johns Hopkins hasn't ranked those in terms of high, medium, or low, perhaps Dr. Ariola or somebody in our health department could take a stab at that. But, in Johnson County, I think we would certainly want a category for professional offices, and something, and then there's subsets of that, but maybe that's enough. And here I'm thinking about the nonprofits, the doctors, the lawyer offices, and perhaps the city offices could all come under sort of a general professional white collar office type category. I'd also like to see pools ranked here under these criteria if we go with this approach, swimming pools, and municipal court functions, which present some unique challenges. And there's probably other categories that I'm not seeing here that we should consider, but I like this approach. But for this second comment, and that is that I think we should probably all agree that we want to be consistent. And there's one example of what appears to be inconsistency here on this chart. And that is, if you look at restaurants and bars, the first category, they're ranked medium, high, medium under the various risk measures. And then they're given a risk category of 1. And then you go down to gyms and fitness studios, they're ranked as medium, 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 which suggests to me a lower risk for gyms, and they're given a category of 2. I'm not sure if there's a rationale for that. If there is, I'd like to know it. And in any event, I want to make sure we agree on the criteria, but then apply them consistently and fairly across all businesses.
Joe, do you want me to address that?
Yeah, please.
Okay. And so we have noted the other sectors that you want us to look at, and that's part of the intent for us is to hear back from this group if there's any sector that we're missing, and you have done that. If others have other sectors, please send it to us by email. We will do our best to do the rankings. And also to, again, to the rankings, they are meant to generate this kind of conversation. There's some of them that we actually ranked differently than the John Hopkins piece. And so there is the taking, again, into consideration the ease of modifying what you do and the ease of taking risk mitigation processes. Gyms, there's close contact. There's not there are limitations as to what you can do. But we feel like restaurants, if you operate at not 100% capacity, you probably have a better chance of doing physical distancing. So maybe there's a modification of those rankings that happens after the mitigation step. But I understand your point of being consistent, making sure that the ranking is consistent with the characterization eventually, and we'll work on that. But they're also intended to generate this type of conversation among the group, where we're not intending to tell you this is what it is, and if you disagree with the ranking, that's okay too. We will modify that.
Sure. Thank you.
Ed Eilert's here. I want to go back to the Governor Kelly's order and looking at the essential services. I was surprised at the breadth of industries that were considered essential services. Not that they shouldn't be, but for instance, insurance services. And as I think about that, I'm thinking about insurance offices, agency offices that provide insurance services. And another question I had, and Stan, perhaps you can clarify this, medical care and services. And I think in more than one place it talks about medical care being exempted. And to that point, I'm thinking about optometrist, vision, and dentist, those kind of things. What restrictions do you operate under, Stan?
Mr. Chairman, a lot of the health systems are working on our internal phasing as well. So as we look at it, and we were just having a meeting this morning with our physician leadership, and I'll give you an example. And my example will be one that I'll also be sharing with KHA, but I know that other health systems are doing the exact same thing right now as they're ramping back up from the health system perspective. And that is, for example, phase one, and these come off of some national guidelines that are examples of what people can follow, and there seems to be a mainstream of several of them. But phase one would be like ramping up some diagnostics that are non-aerosolizing or not considered procedures, i.e. mammograms, or ramping back up some of those elective diagnostic procedures that we do. And then phase two would be where you do some interventions, but it's outpatient only, so that it's modified so that that risk is just incrementally going up. Phase three would be combining the outpatient and potential inpatient aerosolizing procedures. And then phase four is business as usual. I share that with you just that know that that's an example of what I'm anticipating when Scott mentioned they have their own societies for phasing, and all the other ones that Tracy mentioned with different businesses doing their phasing. We're technically not different from us preparing phases like that, except for the fact that I think yesterday the president gave us the green light to start doing some of those phasing in of elective procedures. And I know that our legal counsel had even indicated that the whole reason we had tightened those down was related to space, staffing, and PPE in the beginning. And so now that we're seeing those levels lowering, all health systems from the ability to go back up, now that we have more PPE and we have the space for it, the big peak did not occur. We're ramping up our own individual phases. But as it relates to opening up surgery centers and what cataract procedures may be and what that looks like, for some of our locations, that may be the outpatient that goes into phase two procedurally. There are a lot that are looking very similar to what we were just describing, that instead of saying it by, phase one will be, first week, phase 2 will be the second week. It's all about how can we accordion it out safely to ensure that the standard operations for phase 1 makes sense, and then feel comfortable with phase 2, what that looks like. We have another factor that we have to balance, because a lot of our providers that are going to do procedures now are also doing the pre-auths and all the safety and calls for patients before they come in, to make sure at the end of the day, it's balancing PPE with the safety of our staff, providers, and our patients. And everything we're doing ties to that. And I gave you a broad answer. Now I need to ask, did I answer your question?
Well, I guess it was more specific. If your industry is considered essential,
Right.
then or whatever industry is considered essential, then it's basically up to you to develop the guidelines. What I'm trying to separate is our focus on areas that are not considered essential, and really, what does essential mean? Do you have your own ability to present your guidelines? And if I'm in insurance services and I have my insurance office, does that mean that whatever we develop in the phasing, I have my own abilities to develop my own guidelines? Do you understand?
That's my understanding. And really, as this epidemic launched, I think there was a lot of confusion in the very beginning of what were essential businesses or not. My question would be, I don't know if that's changed from our standpoint on the essentials from our suppliers for healthcare, for all the grocery stores, the gas stations, et cetera. I just want to make sure I'm answering your question, Mr. Chairman.
Let's go ahead. I will. You've partially answered, but I'll need a little more understanding from staff, I think.
That's okay. No, I was just going to try to clarify the question. I think, Stan, the question I kind of have for you is, you've been in essential business from day one. Have you voluntarily chosen to close some of your outpatient clinics and essential or non-essential surgeries, or is that required?
That was voluntarily done across the nation, really, but it was off of some recommendations from the federal government. But we were it was easy for us to do that early on, because we were looking at the space capacity issues that were going to overwhelm our systems, and again, staffing and PPE supplies. But as we ramp back up, the ability for us to move back into those service offerings, we do have the flexibility to do that at any time. And I do know, talking to, as an essential business, we can do that. And talking to some of my peers, some of those are going to start those diagnostics as early as next week. And then after May 4th, looking at what that looks like for potential aerosolizing procedures. Many of us have recognized that patients that are limiting their elective cases right now, there are stories, as you can imagine, of patients that are now moving into more urgent and emergent care and more critical needs because of putting that off. And so we've made that balance between what we've seen inside our systems and then what we're expecting to do for our patients.
Thanks. Yeah, I think it's a good clarification. If you're an essential business and you've cut back, you've done that on your own.
Correct.
And you're not bound by the governor's order or a Johnson County order to do that. So.
Correct.
Okay, Commissioner Brown.
Thank you. So just a couple of thoughts on the line about hospitals and doctors. It seems, I don't know, I'm a contractor and I happen to also serve as a county commissioner. I'm not comfortable telling a doctor how they should operate their office safely. That seems like that should be self-policed. And if they want guidance, I guess some could be provided, but it seems redundant and unnecessary for this group to provide that to the medical care world. My daughter is an RN in the Dallas area and was furloughed several weeks ago because they moved into the realm of and she is in an elective surgery setting. They had been asked, not demanded, had been asked to shutter their operations as a part of non-essential. But my daughter had also informed me we were going to have to do it anyway because we didn't have access to all of the PPE stuff. We were going to run out. We were going to close one way or we were going to close the other. So it was going to take care of itself. And I suspect that's not an isolated case. I think that probably occurred nationwide with anything elective. That's outside of a hospital setting. So those are two thoughts. I feel like if we're wading into the water of telling people in the medical profession and doctors' offices what they should do to be safe, we're preaching to a choir that is acutely aware of the concerns and issues around this. Thank you.
Thank you, Commissioner.
Yes, Ed Eilert, exactly my point. In looking at the essential services that have been identified by the governor, we need to understand what those are and that they are going to have their own capability beyond any phasing plan that we might develop. Good point. Yes.
Thank you. Tracy, another question?
Commissioner Brown addressed part of that. You know, a lot of it was, you know, supplies being reserved for what's truly necessary within the healthcare environment. But to address, you know, some of those other ancillary businesses, you know, within the healthcare system, you know, hearing from dentists and optometrists and, you know, all of those other businesses, you know, many of them, yes, were still functioning, but some had chosen to do only emergency services and some providing, you know, just a bare minimum. But the one thing that I think this group does address that impacts some of those is the social distancing requirements. So when those are lifted in whatever phase that is, if it's phase 3 or phase 4, then I think that's the clear signal to the public that we really do have the all clear. And, you know, that's when, you know, maybe if you've been putting off the eye appointment because, you know, you really didn't need it, but now you feel comfortable and that eye clinic can go back to full capacity of seeing, you know, however many 100 patients they usually saw in a day, because that's what we're hearing, you know, they are a business just like any other business, and they are not operating at full capacity.
Tracy, Commissioner Hanslick, you got your hand up?
Yes, I just wanted to say, first of all, I completely agree with the comments that the medical community does not need our direction in terms of getting down in the weeds with how they should maintain safe distancing and sanitation procedures. However, I've heard from a lot of businesses that they are looking for specific guidance, and Tracy may be able to speak to this more than I can, but there's concern about liability. What is it that they should be doing to ensure that they will not be held liable if someone gets sick in their office building, or somebody claims that they have not followed the correct procedures? Tracy, maybe you can speak to that, but I think it is a fine line to walk in terms of how much guidance we give. But I have heard from a lot of businesses who do want some specificity from us, especially from that liability point of view.
Yes, Commissioner, it's my understanding, and I don't have the details because we were on this call, but I did receive a notice that I know that that's a concern that the governor is well aware of. The state chamber is working on that. They know that that's shared by businesses across the state. The U.S. chamber also working on that. You know, unfortunately, I don't think that's something that's going to be resolved before we go into phase 1. But I think as long as we're aware that that's an issue and we try to resolve it as a state as quickly as possible, we do have people working on that.
Thank you. Thank you, Commissioner. Scott Anderson?
You know, I'll just add, I really think the guidelines are important when it comes to businesses where you're interacting with the general public on a significant basis. Restaurants, salons, you know, everybody wants to know the rules. You know, the restaurants want to do the right thing. Customers want to see you're complying with the rules. When it comes to healthcare professionals, when it comes to Garmin, they're big companies. They know what to do. And on top of it, I mean, I will say, I guess I paid for the law degree. I'll use it a little. Using these standards as some kind of a defense in a lawsuit that you filed them or you didn't is, in my opinion, useless. These standards aren't going to shield anybody from liability, in my opinion. But I do think that's why I think the big businesses are the ones, they're going to protect themselves regardless of what we do. The Sprint campus, the Black and Veatchas, they're going, they're worried about lawsuits. They're going to they're good companies, but they're also worried about lawsuits. They're going to do the right thing. I think a lot of our focus should be on these customer-oriented businesses where you have a lot of interaction and the public and the businesses want to know.
Yeah. Commissioner Brown?
Thank you, Joe. It seems to me that when we're talking about liability in this, that but for the state of Kansas introducing and passing laws and putting into statute limitations on liability for these things, or guidelines for what responsibility and liability will be rendered. It seems to me that our conversation around that is the legislature is going to have to get in front of this with legislation to get to put a curb in so that this does not run rampant. I can see that there is huge exposure for any and every company that chooses to open up. And so there's going to have to be some curbs on the liability. And I would expect and call on our legislature to take that up as soon as possible. There needs to be curbs put in. Thank you.
Thank you, Commissioner. Julie Brewer?
I'd like to just revisit one area of the conversation that we talked about last week, and that is different barriers to reopening, specifically barriers to access to PPE or barriers to access to testing of employees or clients. And I'm thinking of the nonprofit sector. So just using, say, our Human Service Fund year-end report as a measure of number of residents who utilize health and human services in our county, that would be about 10%. And that was at a time when unemployment was below 3%. We're entering into a recovery phase where unemployment, at least in the short term, is going to be much higher. And we anticipate utilization of services to grow. And part of what we did in our very brief survey, and subsequent to this meeting, I'm more than happy just to send this group the results of the survey. We had about 68 respondents representing 51 unique agencies. And we asked them how they've adapted their services and functions, and what are their barriers to safe return to work. And number one is access to testing for employees. And number three, and number two is for clients, and number three is PPE equipment. So I'm thinking of some of that emergency assistance and case management and mental health services and qualified health partnership clinic. Some of them have better access than others, but certainly that's a high concern. And unfortunately, as you can imagine, where they get their funding from and how those funding streams work are very fragile and are more fragile now. So large scale investment in PPE may be a big barrier to some of these agencies coming fully back online and being able to serve what will be an increased clientele in our community. I don't know what our options are there, but I would like some consideration of that in this discussion.
Ed Eilert, let me ask this question. We've been on this call for a little short of 2 hours, and let me focus on one thing. Scott mentioned it, and others have mentioned it. Going forward, should we concentrate on guidelines as Scott has presented for the restaurant industry, for the salon and barber shops, and there may be other service or businesses which have a direct and immediate contact with clients, and then we have the business offices over here, and maybe it's 10 square feet based upon your square footage. Then you've got the Garmins and the Sprints and what have you over here in another category. Does any of that make sense?
Chairman, this is Penny, can I add to that? Perhaps a next step, and I don't know if we're quite ready for that or not, but is to do between now and Monday carve out certain pieces like you just suggested, or others, and others perhaps, that few committee members could work with staff on certain pieces and beefing up certain pieces leading into Monday, which means over the weekend. I don't know if Joe or Chairman, you have thoughts, or others on the committee have thoughts on that, or how long you want to go today.
Yeah, I think that it sounds like to me that we're moving, but we got the little bit of work left to do on this document before everybody gets comfortable. There were some kind of major points brought up, most around the definition of how businesses should be operating and industry guidelines. So I would certainly welcome, a few of you who have an interest to help us with doing some research and help us put this document together so that Monday it'll look more like pretty close to a finished product, we hope. That's kind of the goal I'd like to see.
Yeah. Let me ask you this, ladies. I'm not an expert on hair salons. I have talked to several owners and have some ideas, but is there a volunteer to get together with a group of hair salon owners and establish some guidelines? I'll put it that way.
Chairman, Mike Brown.
Oh, sorry, Commissioner. Go ahead.
Go ahead.
I've received, I don't know, 4 or 5 emails in the last 24 hours or so from very small one-person hair care salons, as you can imagine, not a field of expertise of mine either. But I've received from one-person shops, and I've received from what I think is probably some of the biggest shops in Johnson County, a combined thought process. I will put that into one amalgam and I will send it out to the group. I think that many of the things that they've suggested that they abide by and guidelines that they place upon themselves are probably more stringent than probably I would think this group would even come up with. So they're pretty good at policing themselves. They have a stake, much like the restaurant owners and other businesses, in not being the place where someone goes and gets sick. They have a vested interest in it being safe and secure. So I will share that with the group. I will email that to everybody later this afternoon. Thank you.
Well, that's good. I've received those same responses also, but again, if there's someone on the task force who has better experience with those shops, I'd like to have that kind of feedback also.
And Mr. Chair, I certainly won't pretend that I have a lot of experience, although I am a customer. I have someone on my board who, like Commissioner Brown's contacts, has been working very diligently to prepare some standards. And so I think we've probably got a number of things that we could push together. You know, I'm happy to work on that, although I'm very interested in some of the other industry guidelines as well. So I'm happy to provide what I've been given if someone else wants to work on that particularly. So I can send that out to the group as well, because I think Commissioner Brown is right. Whatever they come up with, I think is going to be a higher standard than what they receive from their own industry.
I think you're right. Well, let me ask an additional question. Besides those 2 services, what others might require a closer coordination? You know, the retailers, many of the retailers, certainly the grocery stores and others, have set up the plastic barriers at the cashier level. So you know, that's already been accomplished. But I'm thinking of the restaurants and the hair salons who have a close interaction with their customers. Are there others that we need to identify?
Chairman, I am hearing from folks in the personal training industry. I've received multiple communications in the last 48 hours from people in the personal training realm, saying that they have protocols that are similar to what we're talking about, I believe, with hair care, including barbers. And they have concerns, big concerns. I've received several, and I think you were in an email string of one here just within the hour.
Right. No, good
I
point.
I think along the same lines as what Commissioner Brown's mentioning is, I think also looking at gyms and fitness centers, because there are a variety of different sizes and types of gyms and fitness centers, and many of them do include personal trainers. So I would suggest that that's another group that perhaps needs some additional attention. And I also might mention massage therapists. I've been contacted because even though they probably would fit in the category with salons, spas, and other personal care industries, massage therapists do have a little more literally hands-on contact with people, and they were asking for some additional guidelines. I would also say, if you haven't had a chance to look at the Alabama plan that Tracy had shared, there are some very specific industry guidelines in there. There are guidelines for salons and some other industries that it might be helpful to consider what that plan includes too.
Okay, thank you. Scott Anderson?
Just to reiterate that, the two I've heard from a lot too, I agree with what was just said. A lot of massage places are asking. And then also, even like everybody wants to go back to the gym. Even Lifetime is opening up their first facility in Georgia as well. I know the manager here at the Lifetime at Lenexa well, and they're opening their first facility in Georgia. And they drafted procedures. They're talking about having personal trainers come in and just train a handful of clients that want to be back as a first process, a first step. No contact with clients. There's stringent cleaning guidelines. They just put together a policy, and their Georgia policy. I'd along with the personal trainers, I'd hate to leave out the big gyms too. I mean, just because they're a big gym, I don't think by any means they plan on packing it full, but they'd like to, have a handful of their guests back, spread them out throughout the day, and get people back in shape.
Okay, thank you. Stan?
When I first looked at our recovery plan draft, I was very pleased to look at the business groups and the categories. And I know that we see that nationally, and I know that there are some detailed reports of what we can accomplish. I'd probably encourage us, though, to look at kind of beginning with the end in mind. When you look on the right-hand side of those tables on the risk management and reduction strategies, no matter whether you're low, medium, high, whether you're going to roll out first, second, or third, whether you're 10 people or 2,000 people, when you think about it, when we're finished, I would expect that we're looking at, obviously the safety of our communities as we roll out these businesses to get back into their normalcy. It's really wearing your mask, keeping your 6 feet away, making sure you're maintaining the social distancing, adjust your layouts. I can't help but to think, if we looked at the 30,000-foot view, is it worth our time to dive into the details by these different locations, knowing firsthand that as we did this through our incident command, and we never stopped working in the health systems, every day for the first 4 months, we were making improvements and taking in suggestions from the external resources and expertise to enhance what we're doing. Should we look at it going back to the universal precautions, the must-dos, basic must-dos? Here's what we do. Use the words encourage. And then at the end of the day, what I keep hearing that the businesses are doing out in the community, they're already expecting on their ramp-ups to look at social distancing, how they disinfect, how they would mask. My impression is, even if we go do this and we go look at these locations, we're going to come back to the same answer, which is, what's our recommendation to them? 6 feet away, social distancing, disinfect, manage what you can do inside your businesses, no matter how big or small. Should we keep, and I know we have references around the nation that appear to be best practices, and I started with, I like this table at first, but as we've evolved, beginning with the end in mind, should we stay at the 30,000 foot view and recognize and appreciate no business, no matter how big or small, wants to be the outbreak in Johnson County. No business wants to be at the front of the news saying, we didn't follow the encouragement from the task force to do the social distancing, do the disinfecting. We did some things that we shouldn't have. And I would say that if there's the one or two businesses that are rogue that aren't going to pay attention to our recommendations, they will suffer the consequences for being rogue, but also their patrons will judge with their feet too. I think Scott on Wednesday said, if I don't do anything and they walk in to see my restaurant and I haven't made these preparations, they're going to turn around and walk out. Same thing's going to happen for any business that we're looking at. So I would maybe have a step back a second and say, is it good enough for us to begin with the end in mind with that right-hand column on all of this, recommending on our universal precautions and the 6 feet social distancing, and encourage them, all businesses, to look at their associations and their best practices in the county and the state and the nation to keep their businesses protected from becoming an outbreak. Just a philosophical approach to how we could look at this and still accomplish what you'd like to have done by next Monday or Tuesday.
Sure. So just to understand what you're saying, Stan, I mean, are you saying there shouldn't be any phases at all?
Now, inside our own health system, we have phases. So I guess the question is, do we leave that responsibility to the businesses on how they are going to phase themselves, just like I'm doing in health systems, or do we want to dictate that at a county task force and county level of what those phases are? Now, back to Dr. Ariola and our medical and our health professionals on pacing it, grabbing data, ensuring that we are safely protecting the constituents. Are we still going to be able to get that data no matter how broad or narrow we keep those phases, trying to place those businesses in those buckets from our standpoint? I would encourage that those businesses are already thinking of how they'd face it. And I'd like to hear from Tracy and Scott from a chamber and a restaurateur, a business owner perspective. Would you agree with that philosophy that you're going to control it yourselves and we should keep it at the 30,000 foot view on encouragement and guidance, or go through this with the detail?
I would like to do a time check again. I know there's some hands up, and Chairman Eiler, I think he left for the meeting because he has a 1 o'clock call, and you all, I know we originally sent it for 2 hours, and it sounds like we're talking about some next steps on some areas to focus on. So I don't know if others have to be gone by 1, but
yeah, I guess I would really ask to build on the chairman's request. Is there a few of you that could work with Dr. Ariola and myself over the weekend to talk about or to try to insert some of the language and issues of things that we've been talking about today, and again, to help us with your particular expertise, especially when it comes to guidelines.
And there's also 3 hands up still, so.
Yeah.
Or maybe Stan still has his hand up, or if it's,
no,
he's done. Okay. Well, now there's 3 because somebody got added, so.
Okay. Let's start with Chief Reddick.
There's 2.
Well, Stan kind of beat me to the point. I asked the question at our last meeting. I thought our trajectory was determining which businesses were going to open, not how they were going to operate once they do. I think we're going down a road that's a long road. If we start going down the road to provide guidance to every industry, every business that seeks to open right now, I just think I think we should trust the businesses to do the things the right way. And I think Commissioner Brown brought that up. Social media can be swift and very punishing. If people aren't doing their business the right way, they're going to know about it very quickly. And I bet they do start doing the right thing. So I think, I just think this is a road that we may need to consider whether or not we want to go down this road.
Totally agree.
Thank you, Chief. Mayor Michelson?
I want to agree in part with that line of thinking, but also raise a concern. if we go with, I think what you're suggesting, Stan, is more of just a general rules-based or recommendations approach as opposed to a lot of detail behind specific businesses. And I certainly open to that direction. However, if one of those rules, for example, is 6-foot distancing, we will need to create exceptions, will we not, for certain businesses like the hair salons, like the massage therapists, because they cannot maintain 6-foot distances right with their clients by definition of what they do. So maybe there's a balance there, but I still think we're going to have some specificity by industry. My second point, and maybe I'm going to be a little bit of the bad guy heavy here, and I'll be open to being convinced otherwise. But I agree with everything that's been said about recommendations and guidelines, and 99% of people are going to comply as they have been. However, if this is all that it is, education, we are and we have had on the edges violators, including some intentional. And if the message goes out that we are not prepared to enforce violations, in that these are just recommendations and guidelines, I think that's troubling, because it's going to make people less likely, I think, to comply who are kind of on the fence. It's not in the public health interest if we do have violations. And I'm not sure it's fair to those businesses and individuals who are going to the expense of complying to have a competing business not complying and telling them that there's no law enforcement remedy there. So that is just a concern I have about a pure recommendations guidance approach, as opposed to some at the end of the road for intentional repeated violations, knowing that they're going to get a ticket and have to pay a fine or appear in court. And I'm not sure that's what you were suggesting. I thought, no, there's two different concepts there, Chief and Stan, but I just wanted to weigh in with that concern.
Sure, and I'll just speak for, and Chief, you can weigh in here, but there was a kind of a consensus on the approach, and they actually did kind of walk through what a, citation scenario looks like.
Sure.
So Chief, I believe that's still in place, is it not?
It is, yeah. And if I don't mean to say that there shouldn't be any type of regulation going on within a business. Let's put it that way. I think the social distancing, keeping it broad, but when you go into the particulars for each industry, I think that's a tough road to go down. And it sounds like that's what we are going to do if we're going to provide guidance on how those businesses should do that. I think that's going to keep us busy for a long time as a task force. And I think that's allowing them to self-police, for lack of a better word, on how they're going to do certain things with some broad parameters that we've been working under for quite some time now, and leave that as our roadmap. But yes, as far as the education or education/enforcement component, what we've been working on for several weeks now is, as businesses stepped out of line, local law enforcement would go do the contact with them. And like I said, it has been, as far as I know, 100% successful in getting compliance when we have an educations and component to that, and just contacting them, making sure that they're aware. The enforcement component we haven't had to use the hammer on any businesses, and I just think that speaks to Johnson County. And to be honest with you, I see no reason why that wouldn't continue.
Thank you. Tracy?
Just wanted to make a clarification and certainly support what Stan has suggested in terms of kind of overriding recommending guidelines. I think what our businesses have asked us for is just tell us what the rules are, and they haven't asked for lots of rules. They just want to know what they are. And, as long as, whether they're industry specific or not, they want to know what the guidance is. And so, I think it's fine if we want to have, blanket recommendations. And then, I think everyone knows, if they have a lot of contact, closer contact, then they're going to ramp that up as it applies to their own industry. Or if it's not close contact, as it will be in most of the professional office settings, then they don't have to be quite as concerned about that, but just maintaining social distancing. The one thing that I would still encourage, and I think we addressed this a little bit, but I just want to clarify, is that we would still have phasing. as it pertains to number of people in a group. So, starting at 10 and then go to 50. And then I think that's where we don't clarify is at what point do we go, do we make the next step? Is it, 50 then to 100, or after we hit 50, then when we're good for a specified period of time, either 14 days or 28 days, then is the lid lifted and then we've got the all clear. So I think we can discuss that Monday, but I think as long as we still have the phasing in effect, then I'm comfortable with some pretty blanket guidelines that are really recommendations.
Sure. So it's kind of a.
And I'm happy to help over the weekend if you would like.
Thank you. So a strengthening of the section you see on the screen now, the universal precautions provide that overall kind of guideline approach. Is that kind of what I'm hearing you say?
Joe, this is Mike Brown. So I would like to chime in right here with that question. I understand and I appreciate Mayor Michelson's concern. I do. There being an implication that there's no downside for not complying. I understand that risks creating an environment where some may not comply. I would submit as a counter to that, and I talked about this at our last meeting. The pressures that are going to come upon any business or any entity that is flagrantly ignoring this through the use of social media, it is going to come down like a ton of bricks on them. Everyone's got a phone, everyone's got a camera, everyone can video it, it can be posted on social media, and the pressure of that, in my mind, is much more severe than someone being issued a citation, because with a citation, it happens in court. They pay a fine, they appear in court if they need to, whatever the process is. But there's a public shaming component, and it'll be swift and it'll be harsh. And no business owner wants to find themselves on social media in that position. They just don't. They're in business to appeal to the broadest part of the market. They do not want to be carved out because they're not compliant. And I feel like there's a lot of peer pressure in that realm. I also want to point out that I'm hearing from a lot of folks right now on both sides of this issue, in fairness, but on the side that says we need to open up, the clamoring of my rights are being stepped on and violated. Now, whether any of us agree or disagree, I think it'd be hard to disagree, but I also understand why we're doing what we're doing. So there's a balance, but those folks are becoming more agitated as we go. My concern is you send law enforcement into their business or into their operation, I'm afraid you create a flashpoint with a heavy hand. So I really don't want that to happen anywhere in our county. And I'm afraid you're setting a gradient that doesn't turn out good in the long run. So I think the peer pressure component is severe. It will be swift and it will be harsh. And I really feel like that is more of a consequence for not complying than anything else that this group could put in order. Thank you.
Thank you. Julie?
So I'm going to be a little bit unpopular because I'm a little concerned that the pendulum's swinging too far the other way. One, I'm also an employer, so I fully concur. I don't want to come into the work site every day and have to have a list that I go through because I have so many rules that I can't remember every step I have to take to make sure the office is safe, the employees are safe, I'm abiding by things. But also, just as this is new territory for all of us, it's a new territory for all our residents. We have taken the pendulum very far with the stay in place. If we don't come back, certainly we've got to have the phasing. I think there has to be some parameters that are beyond just the high level, especially when you get into certain industries where it has already been stated, maintaining a 6-foot distance just is not, you're not able to perform your task in that. So I do think I want to fall somewhere in the middle. I want to have enough framework that I clearly understand what the safety measures that are being taken. I clearly understand how to do it. I don't have to have literally a binder of pages I flip through every day to make sure I'm doing everything I'm supposed to be doing. And I do want to keep in mind that part of the reason we're taking this approach is because the ultimate intent is if there is is one, not to go up in our numbers, and two, if another wave comes through, that we're insulated against having to do a complete shutdown again. Because my goal is not to have to do a complete shutdown again. So I just want to make sure we can have that compromise of enough guidelines, especially if you have to have some that are industry specific, without being overbearing and almost impossible to adhere to. So I would go deeper than just the universal precautions and basic must-dos.
Good comment.
Okay, Commissioner Hanslick?
Thank you. Yes, I was going to say very much along the same lines of what Julie just said, that I think there's a middle ground between having voluminous procedures for each industry, but also having some industry specific guidelines. And I would look back to the Nashville model, which I think does a good job of giving some industry specific guidelines, but not going into something that's just too hard to put in place. But I do think too that we're here because we've agreed to be on this task force because we feel a responsibility for public health. And I think that the public is expecting us to provide guidelines to businesses and restaurants and other places that they're going to start frequenting. And I think there is an expectation that there are some industry specific guidelines. We don't want to wait till something happens and somebody gets terribly sick or there's an outbreak out of a certain area. To me, then we have failed in our job, because we need to also be preventive, not just there'll be consequences either on social media or elsewhere if businesses don't comply.
Thank you. Stan?
I would agree with what's said, and I'm looking on the second page, right underneath universal precautions. We have some great paragraphs on phased approach to recovery. And if this is a balance, I fully support the fact that if you have universal precautions, but we do say coming out of this task force, we do expect that there's a phased approach to recovery. And those first two paragraphs, I think, are very well written on what's expected from this task force and what the county would expect. I think what you could add to it, instead of us going into our recommended phases as a task force for the county, you could make statements like, we also expect or encourage best practices by industry. We may even in ours give some examples, because even when we look at those best practices from other states, they're going to continuously evolve from there. And one of the concerns I'd have, if we start laying down some of those best practices today, they may not be best practices a week or 2 weeks or 3 weeks from now. But if we say, as of this point, some best practices by industry that you should consider businesses would include these things, I think that also ties in to some of the concerns that it's not just a 30,000 on the universal precautions, but we're also telling them, we do expect you as a business to do phasing. It's expected. And we also expect you to look at your association's best practices or other best practices. And we, as a task force, felt it important to at least give you some examples of that. So if there are some, of course, everyone go online, look that up, and I think it's pretty quick to find it. But it's okay, I think, for us to also say, these are some examples of best practices that we see. I think it'd be important for us to end it that way. I also just want to go back to number 1 on universal precautions very quickly, is where it says encouraging our citizens to wear masks. I will tell you in the health industry, as I mentioned before, we already went to our primary and secondary sources for PPE related to masks and face shields and gowns and et cetera. What the others may find as these businesses are wanting to do is
Stan,
protect.
Stan, can you back up
primary-
a sentence? You broke up real bad. You stopped.
Oh, sorry.
That's okay.
Okay, did I stop with what face masks with the industries?
Yes.
Go to your primary and secondary sources.
Okay, so just that we do want to protect the health system's primary and secondary sources of masks, because if all the businesses go out and try to use what we would consider our primary and secondary sources, and we're working with those suppliers to ensure that we get our supplies. Yes, it sounds greedy, but at the end of the day, we're the ones that will be on the end of those, caring for those that might be sick from this. We have encouraged, though, there's a lot of new vendors in this space that want to provide PPE for businesses too. And so we would love to pipeline those suppliers to all the businesses and let them, of course, buy
Out again, Sam.
other
Sam?
PPE, include masks. If homemade masks and because that's happening, I'll just say I would encourage those businesses to look at what we would consider our tertiary resources or homemade masks to protect our supply in health systems. Did that come through?
Stan, to be clear, we were not thinking of, we were thinking more of barrier homemade masks when we wrote that. So we'll put the clarity there. Yeah.
Perfect. And if that's added to this, that'd be great.
All right. Thank you, Stan. Well, listen, we're a little bit past 1 o'clock now, so we had some really good discussion. I think that Dr. Ariola and I have our work cut out for us, and so I appreciate kind of the direction that we're taking today. Thank you to Tracy, and also Commissioner Brown. I received your text about some help over the weekend. If there's others, please email me and let me know, and then we will begin to work to get a hopefully a much more polished product for our meeting on Monday. With that, I think we can call this meeting. Oh, we have one more question. Oh, okay, Commissioner Hanslick, I see your note on the chat as well. So anyway, we can call this meeting over with, and thank you so much for your time, and we'll look forward to getting together on Monday. And again, we will do our best to get another draft out as soon as possible before the meeting on Monday. So thank you all very much.
Thank you, everybody, for joining and for your time. Thank you.
Thank you.
Thank you.